All right, folks, good morning. Today is March 3rd, 2023. This is Coffee with Community Services, Alta California Regional Center's weekly vendor meeting. This meeting is recorded. The recordings of the meeting end up going on Alta's website and can be downloaded there. My name is John Decker, the Director of Community Services, and I'll introduce some of our community services staff. And let's see, we got clinical, we got all kinds of folks on today. So um, let's see, I'll start off because she's at the very top corner. We have Camelia Houston, our Director of Intake and Clinical Services. Good morning, Camelia. And we have Jason and Alicia who have joined us. They're going to give some presentations, and Rima this morning, our deaf and hard of hearing specialist. Good morning. Damien from our Community Services Department is here this morning, and Shirley as well, and Denise and Leah. And let's see, we have our managers, Michelle and Helen are on from Community Services. Adriana's on from Community Services as well. We've got some client services managers on. Kanisha's here, and Christina, and Dana is on, and Cindy Lay, and we have Rowena on, and let's see here, any other client services. Wyatt here is here, Wyatt Stroman as well. Good morning. I think I saw some service coordinators. I think I saw Bailey, Aida. Who else? I have some other folks that are on from case management, and we have our associate client. Oh, Danny's on. Good morning. I see Danny on there too. Good morning, Danny. So relatively big agenda. A lot of our case management staff. There is directors of client services for all the regional centers meeting going on downstairs in our Brenda Smith conference room for the last 3 days. And so many of our case management executive staff are over there, and our associate directors. For today's agenda, we are going to be discussing an update on HCBS, which I think you're only going to get like a few more of these updates, and then we'll have to find something new for Alicia to present about in these meetings. And then we're going to do an update on the Coordinated Family Support Services with Jason. We're going to talk about the new DDS directives that came out. Surprise, a change as it relates to remote services at the very last minute. So we'll talk a little bit about that as it relates to behavioral services for clients. We're going to discuss, let's see, housing specialist. Alta is going to be hiring a housing specialist, so I'll discuss a little bit about that. We're going to talk about COVID tests and the availability of COVID tests. Rima is going to be sharing the sign of the week with us that she has already sent out to our staff. And let's see, and I'll say I see Phil popped up there, so I'll say good morning to Phil Perez as well. Try to catch all of our staff as they log in the mornings. We'll be discussing our upcoming community placement plan, community resource development plan, RFP orientation that's coming up, what we're looking at doing. I want to talk a little bit about DDS's technology pilot and Alta's kind of assistive technology activities that we're doing right now. And we'll discuss a little bit about the social recreation grants, and we've got upcoming vendor forums. And then I think I'll try to give as much of an update as I can without Carly here about Sierra College and some of the activities that are going on over there as well. So hopefully everyone is in the right place still. We've got 66 folks on this morning. And so why don't we go right over to, and I see Zach this morning, my assistant. Good morning, Zach. So Alicia, why don't we start off with you? And I've got last week's spreadsheets and this week's spreadsheet or today's, I should say, last Friday and today's to share on my screen. And so why don't I share that, and then maybe you can talk with us about where we're at. So let's see, are we seeing DDS's spreadsheet here? And
yep.
It has our regional center on it, and this is the spreadsheet from last week. And then this is the spreadsheet from this week. So yeah, what's going on in the last week since you talked with everyone?
All right, well, I can tell you what's going on in the last 3 hours since they sent that. We're at 93% right now, but that does not include the 10 providers that we got compliant this morning. So we will definitely be into the green on Monday, unless they change the color codes again.
What do you mean change the color codes? Why are we still in yellow even though we're at 93% now?
Yeah, so in order to be in the green, you have to be above 95 now instead of be above 90. So they changed it right when I hit that limit.
DDS likes to
Um,
keep Alicia on her toes.
they do. We are down to 20 non-compliant providers, and that's 20 service codes. There's really only like 13 or 14 providers among those service codes. We have meetings set up. I will be on the phone all afternoon and probably all next week, getting them all done. Um, the only service codes that are left are those of care homes, all day programs, all employment, all of those are completely 100% done as of now.
Awesome.
We also have 0 people on the list of people who haven't submitted anything. So every single person has submitted something. So that list is
So
also
does that mean
taken
we get
care
to
of.
let people do e-billing if they've submitted something?
Yes. Yep.
Okay, good.
E-billing
So
has resumed. Nobody is on a referral hold right now, which they were. We had like 30 of them on a referral hold 2 weeks ago. So those are all taken care of too. So we're on track to be compliant 100% by March 17th.
excellent. I'm going to stop sharing my screen real quickly and just ask if anyone has any questions for Alicia related to the HCBS. When I came in, was that Monday morning? Or when I saw folks, Tuesday morning, that's what it was. I saw that you guys had your big meeting with all of the vendors and we got up above 91%. How many staff did you guys, or how many of the staff participated this week in doing this beyond just you, Alicia?
There were 10 of us total on Wednesday.
Awesome. So, and I illustrate that because it is a really big group effort. Alicia's coordinating a lot of these activities, but it speaks a lot to you all as service providers that you are getting this done. And I just cannot credit enough all of our community services specialists that have been working with Alicia to make sure that we can get folks compliant here towards the end. So I'm really proud of all the work that folks have done. We look like we are going to be on track to get ourselves fully compliant for everyone. And again, putting referral holds on care homes and day programs is not something that we need when we are already under resourced in so many different areas. And so being able to take people off of that and get these things moved on is something that I'm very, very pleased with because we don't need any extra challenges in trying to get folks served. So um, either Alicia or her manager, Michelle, anything else about HCBS we wanted to share with folks?
No, I think I put the email in the chat as normal. I know there's been a lot of questions about modification processes where you have a client who doesn't quite meet those needs. I can answer any of those questions or concerns that come up. We're always available at that inbox, which is posted.
Excellent. All
And
right. Well, again, oh, sorry, go ahead.
I just wanted to share that we thank you for everyone that submitted some letters for proposal for the HCBS grant. We have taken those proposals and we have submitted to DDS. So we still haven't heard anything. That was due on the 1st of March. So once we hear back from them, we will let you guys know.
Yes, we were able to get proposals for every single dollar that we had available, what was the grand total that we were able to give out with this project, guys?
It was 989,000.
And we had how many business days to figure it out? 16 business days,
Yes.
right? So again, appreciate all of you service providers that responded back to Michelle's message. And we got some really good proposals and we'll see kind of where we go from there. We're waiting for some feedback back from the Department of Developmental Services. All right. We will continue to keep providing updates about coordinated family support services. And so I will throw it over to Jason. And I think, Jason, you're going to be sharing your own screen, right?
Yes, I can. Good morning, everyone. Happy Friday. So just a few updates. DDS has posted to their website the webinars that took place a couple weeks ago. So there's a link there for English as well as Spanish. We are in the process of finalizing our program design template. It's just about done. We have to just make a few edits to it. On March 6th, we're going to be doing a presentation with our case management staff, our service coordinators, to go over this service and to educate them on that. Also, our request for proposal has been posted to our website, and I'm going to pull that up here in just a second.
And while he's pulling that up, I just wanted to, Jason will put the link for the request for proposal in the chat so you guys can check it out. And also the link for the webinar that was updated from DDS, so you guys can access that.
I think the caveat to all of this information is that we are learning about this at the same time that everyone else is. This service is not something that we know, and I will tell you, Rebecca Laborio from STEP Agency was involved in the work group to help develop this service. And so I know she's certainly interested in helping us out with any kind of ideas for technical support, but a lot of the things are really still being defined as far as kind of how this service is going to look. So I will throw it back to Jason so he can describe to you what he's sharing his screen with.
Thanks, John. And can everyone see that okay?
Yep.
Okay, great. All right, so I'm just gonna go over the overview for the RFP. So Coordinated Family Support Services Request for Proposal. Description of the project is CFS providers will coordinate and provide items identified for adults who reside in the family home. CFS shall be tailored to the unique needs of the consumer and the family and their family, and provided in a manner that respects their language as well as their culture. It shall be primarily provided in a person's home. CFS may include, but is not limited to, number one, identifying and providing supports necessary to successfully reside in the family home. Number two, provide assistance and training for the consumer and their family in navigating comprehensive services and supports that are tailored to meet their needs, their unique needs. This includes creating pathways to overcome barriers to accessing generic resources as well as other resources. Number three is providing additional information or resources on the consumer's diagnosis and identified supports. Number four is coordinating consistency and training across providers specific to the needs of the consumer and their family. Number five is assisting with scheduling of service delivery, which includes medical and/or other appointments. Number six is identifying transportation options or services. Number seven is identifying backup providers or supports and providing those backup supports when the plan fails. Number eight is providing futures planning for the consumer, which includes those living with aging caregivers. And number nine, providing training with the consumer, which maximizes their independence. CFS shall not replace or duplicate any regional center service coordination, generic resource, or other regional center funded service that the consumer and their family are receiving. CFS may be provided by an individual who resides in the same home as the consumer. At minimum, the need shall be assessed annually with the progress reported quarterly. And then below that is those that meet the eligibility criteria below are encouraged to respond to this request. And then there's a link there. So the qualifications for direct service provider, CFS Direct Support Coordinator requires an associate's level degree in human services field of study or 3 years experience in the developmental disability services delivery system. The ability to communicate in the primary language of the consumer and their family, knowledge of the regional centers system. The CFS supervisor requires a bachelor's level degree in human services field of study or an associate's level degree in a human services field of study and at least 3 years experience in the developmental disability service delivery system. Exceptions to the minimum qualifications along with the justifications shall be submitted to the Regional Center for the Department of Developmental Services review and determination. The scope of service. Within the first 30 days of working with a consumer and their family, CFS providers shall provide training to their staff and supervisors on the service delivery systems, including but not limited to behavioral health services and local area agencies on aging. Number two, leverage existing community resources to enhance and develop supports that are person-centered and individualized. Cost for proposal submission. Applicants responding to this request for proposal shall bear all costs associated with the development and submission of their RFP application packet. No cost shall be charged to the Alta Regional Center, the Department of Developmental Services, or the state of California. And then below that is my contact information. If you guys have any questions, please feel free to give me a call or you can send me an email as well. And I'll go ahead and put the link for that in the chat.
Thank you very much, Jason.
You're welcome.
So I want to just touch on that last little part there about costs for proposal submission. So we do not have startup funds that are tied to this request for a proposal. I think there is a possibility based on what we receive for proposals this next, well, I would say over the next probably 4 or 5 months. If we don't receive a lot of proposals that talk about serving areas outside of Sacramento, if we don't receive a lot of proposals about serving individuals that speak different languages, specializing in working with individuals of different cultures, and obviously we've got a very diverse population. For our regional center, I would try to see if there would be a possibility maybe that we could try to get some startup funds. But as of right now, the department hasn't allocated any startup funds for these types of services. Right now, it's really just trying to get the word out there, and that's why Jason's got the RFP on our website. We did send it out widely, and then we will be including this RFP with our newsletter that goes out next month. And so when it goes out, it will be translated into 9 different languages because, again, you don't necessarily have to be a long-standing provider of Alta California Regional Center to apply to do this type of service, right? So we do want a broad appeal for this type of thing. I'll throw it back to you, Jason, if you have anything else, and then we can see if folks have questions too.
Sure. I don't have any other updates than that, other than I'm going to put the links to the RFP as well as the links to the DDS webinars in the chat.
And you know what? I do have DDS's website up real quick. And so what I have found is the best way to find things about Coordinated Family Support Services is just by typing Coordinated Family Support Services into the search bar that DDS has. And so I'm just going to share my screen real quickly with folks. And I think Jason said he's going to throw this in the, he's going to throw it in the chat for you as well, the link to this. Yep. But Coordinated Family Support Services, everything all in one place. We bugged them for a whole week to post the webinar recording because we wanted to make sure that our service coordinators had an opportunity to view this newest webinar before we had our question and answer period. I know you guys did a little bit of that with our client services managers last week, right? You guys did a little question and answer period, little presentation to our leadership team.
Yes, I did.
So again, all the materials are here. You can see the website recordings. I have heard complaints from family members that that still does not seem to be amazingly well defined what the service looks like based off of the webinars that were provided by DDS. And so I think we as a regional center we'll work to get as much guidance from DDS as we can. But for many of you that serve individuals that live with their family members, especially thinking about some of the, Chuck Shipley was one of the first persons that said hi this morning. So I always think of people that live outside of the Sacramento area, and especially when we start getting past Auburn and start getting up to the, Colfax, started getting up to places like Truckee, and then certainly on the 50 corridor as well. Being able to get supports in for individuals in those areas is not as easy. And so again, if there is a way where we can utilize Coordinated Family Support Services to provide, some of these additional supports that are lacking, as Jason mentioned, there's a pretty broad scope of different type of services that can be conducted under this new service code. Again, what do we land at, Jason? About $58 an hour, but there's, right, something like that?
Yeah, 58.64.
But then there's also an opportunity to be able to get an additional, 10 or 11% on top of that if you complete all of DDS's to be written reporting requirements. I think we don't quite have the reporting requirements yet, but if you do those reporting requirements, there's an opportunity to have an even more enhanced rate for that service. Jason, so I'll talk to you a little bit about kind of what what I've got assigned for you over the next couple months as it relates to this. So many of you are aware that we have the Coordinated Future Planning Initiative that ALTA has done. Our service coordinators received a lot of training about it. We've been talking about it extensively for like the last 2 years. And one thing that we are interested in is seeing how we can align this new type of service with our initiative. Again, Coordinated Future Planning, talking about ensuring that we have caregiver succession plans for our clients that are living with aged caregivers, making sure that during our IPP meetings that we're talking about a range of different living options at every IPP to make sure that all of our clients have an opportunity to try to live in the environment of their own choice. And so with that, part of as Jason just got done talking about, part of the Coordinated Family Support Services can do things like helping coordinate services for people that are living with aged caregivers and looking at things like future planning activities. So what I've asked Jason to do is to come join our next 2 Coordinated Future Planning Task Force meetings. So we're going to be having a meeting in March and a meeting in April, and we're going to be talking about how we can align this new Coordinated Family Support Services with our Coordinated Future Planning Initiative. So we can provide some real good, once we get some of these vendors on board, some real good supports to clients and families, within the family home on how to tackle some of these things. So we're going to be talking about that. And then also we will be planning for an in-person training on Coordinated Future Planning in the month of May. So we did a web-based version back in October and the beginning of November for our staff. And so we will be looking at bringing those clients, those family members, the advocates, service providers, all the ones that did the training on Zoom before, actually having them in our conference room and providing live training to our staff over 2 separate days. So we're excited about that. And again, if the Coordinated Family Support Services can complement the Coordinated Future Planning, we want to make sure that we can kind of operationalize that. And also, when we are talking to prospective vendors, we want to let them know our regional centers initiative and the importance that we place on the Coordinated Future Planning for our regional center clients that are living with aged family members. So let's see, any questions about the RFP or Coordinated Family Support Services? Again, we're going to do a Q&A on Tuesday with the service, Monday with the service coordinators. Jason will do an overview PowerPoint, probably the first 10, 15 minutes of it, 20 minutes maybe max, and then we'll do a lot of question and answer for folks. But the big question we have right now is, do we have any vendors? Who's ready to provide this service today? And unfortunately, when DDS rolled it out to the whole world 3 weeks ago, that was also when it was rolled out to us. And so we're getting our RFP out. It's already been posted. But again, for us, we will certainly put also when we're looking at the processing of these, if you're going to be serving one of our outlying office areas, I see Heidi here who certainly has that need up in her area. And oh, look at that! Just as she put a comment in there about that, I love it. Folks that speak different languages. Again, we're talking about working in family homes, and so we really want to give precedence and work at getting those vendors up and going as quickly as possible. And Jason, this is going to be, as I said before, this is going to be Jason's baby, and so Jason will be the one that is got that responsibility for this as our lead community services specialist.
And I appreciate everyone's patience because I'm learning right along with you.
Yes, I see Heidi's commented there. Vendors interested in serving Nevada County and more clients in our remote areas will be highly valuable. I think I mentioned this, or maybe I didn't mention this in this meeting, but I did go by our Lake of the Pines development. I got to like get out and take a look at it and walk around the area and see it. So some of you are aware that we're working on a multifamily housing project up in that area, and it's a fantastic location. It is right on Highway 49. It is right behind the huge fire department that is right on the corner right there across from the CVS, if you're familiar where Lake of the Pines is. And so, and yeah, easily, 8 minutes into Auburn from there, and not that far to go back into Grass Valley. So, certainly a lot of opportunities there. We're still waiting about financing for that one for this fiscal year. We're told that maybe it's not absolutely settled yet, that we do not have, that it's been approved. So we're still kind of waiting on that one. Of course, we did get the approval for the Woodland project, which we've already shared with you, but we're still waiting for some financing possibly to come together from the state for the project in Lake of the Pines. So, all right. Outlying areas, I can't say enough, whether it's transportation, day programming, services for our little ones. Like we are resource scarce all over the place. We're resource scarce in, the Sacramento area as well, just not as acutely as people are feeling it out in some of those other areas. I met with a family group yesterday, and talking to parents that have had to have their children come back at home and live with them after years of being in SLS or years of being in ILS because they no longer have like supportive, they no longer have support staff that are able to come out and do that. It's extremely impactful whenever this occurs with folks. And certainly I know, when care home operators, same situation, the challenges in keeping and maintaining your staff has been very challenging, during COVID and the after effects of that as well. So, all right, I want to go over to DDS directives now and talk with you all a little bit about that. And I know Camellia saw one of them that came out related to the remote services. And I don't know if you might have even be willing to share a little bit about that, but I want to go over just real quickly what we have and where to locate them on DDS's website. So I'm going to share my screen real quick. That's kind of like the side effect of attending this meeting, is that something you get called upon to present to like a group of 100 people without any notice beforehand. So we have DDS's website right here, and on DDS's website on the front page, you can go to directives to regional centers. And we don't have Robin Black here today, or I don't think we have any of our ADs or directors of client services on, but we did get an update on the appeals process and the implementation for it. So you can go ahead and take a look here. Again, this was something that came out of the budget trailer bill, and there's specific guidelines here on the new appeals process. I'll be honest with you, I am not an expert in the new process, but they have laid it out very clearly here for everyone because it was something that was included explicitly in the trailer bill language. So that information is on DDS's website, and there's a summary document that talks about the changes as well. So this kind of, one-stop shop where you can see the timeline changes, the participants, changes at the hearing office. It's one of the longer ones from DDS. Let's see, we got 7 pages out of them for that one. So that's pretty good. And then additionally, I will tell you, this one is a little bit hard for me to follow, but apparently there was an update to the billing process that is apparently not going to impact anyone, but internally it's going to make things get processed faster at DDS. And that was related to the self-determination program. Again, you can take a look at it right here. It's not requiring any changes from the SDP participant or the regional center service coordinator, but some internal changes that apparently fixed some issues related to FMS billing errors, approval of FMS invoices, and fiscal year crossover. The FMSs, I know Aviana is on here, but they may or may not have been involved with DDS in some of these discussions to fix these issues. But we certainly have heard the impact that the FMSs have had, the financial management services, with the just large amount of individuals participating in self-determination program. And then obviously we still have, the other services that they support, including the paid internship program and the CIE incentives that they are administering as well. So additionally, we got recently requirements waived. This is what I talked about earlier. Behavioral therapy services and clinical assessment activities for Lanterman Act eligibility. So coming out, I'm going to start talking about this, Camelia, and let me know when I'm going to start saying things that are wrong, okay? So coming out of COVID-19, there was a lot of concerns with the state of emergency going away. We know that remote services were approved for ILS services, right? Day programming services. We know that they are already in law for early start therapies. We know that they are also approved for tailored day services. That's also been a law change that has gone on. But now there is this additional, let's see, what is this? A requirements waived. And so this is for behavioral therapy services and for clinical assessment activities for Lanterman Act eligibility. And so for the behavioral therapy services, again, think of the ABA services that we have. This will allow them, and again, my understanding is, right, this is something that has to be based off of the client's choice and agreed to. It has to be clinically appropriate in order to do it. And then for the clinical assessments, I don't know, Camelia, do you want to chime in on that one as to maybe why this is important to have been approved?
Sure. And I'm going to preface it to say that best practice for therapy services assessment is in person. But there was some concern with the end of the state of the emergency and flexibility with certain families who are requesting to have it continued remotely for whatever reason relative to their planning team. On the eligibility side, we have some vendors who are providing, psychologist vendors to be specific, who are providing their assessments, their evaluations to help assisting in our determining eligibility with the regional center. They're providing it remotely. And this would be a hardship if it was an immediate stoppage. And so we're having discussions on how to fade that out. And thank you, John, for just highlighting that. It should be noted, these aren't changes in law in perpetuity. So this is just extended until December 31st. Both the therapy services allowed to be remote at the urging of the client, and the psych evals provided remotely. So working with vendors to that, we definitely have vendors who are providing psych evals in person. Again, that is considered best practice. And we are appreciative, though, of the flexibility because we are working through a backlog. We have an extensive surge of applicants coming through the regional center from early start as well as over 3. So the extending of this time frame for remote evaluations is grateful. I'm grateful for it.
Excellent. Thank you very much. And again, you all know now where to find these directives on our website. I know sent this out to all of our behavioral vendors so that they were aware of it. I'm assuming all of our psychs are well informed, because otherwise we'd be having some issues effective March 1. So we're still obviously trying to recruit more service providers into these areas, but being able to have some of this flexibility while we're dealing with such a large demand for the service is certainly appreciated, as Camelia mentioned. So thank you, Camelia. And if there's other questions about that, you're welcome to reach out. I think, these are the services that Helen's staff are responsible for overseeing at our regional center. All right, so just let's see, I'm gonna move on now. I had mentioned talking about housing specialist. Anyone that had an opportunity to review Lori Benalis's last introduction to our newsletter, she highlighted a lot of the different housing activities that are going on at our regional center. And that was before we found out that we had been approved for more multifamily housing projects, which we have. But also we put in requests to the Department of Developmental Services for some specialized positions as well to support some of these housing activities. And we are still awaiting responses from DDS on all of the funding approvals, but we are going to be moving forward as a regional center since we have 3 multifamily housing projects in process right now, and we're working on a 4th. We really need a housing specialist. I have been the housing specialist for Alta basically for the last 6 years or so, since we started doing more housing activities. And it's time to bring on someone that can come and join our community services department. They would come in essence, as a community services specialist, but their specialty would be working on housing development. And so this would be, for example, the folks that would be working with our multifamily housing developers and trying to find out new opportunities for our clients and working on a lot of the development side of it. Additionally, I'm writing the job description so that there is a kind of a component of housing navigation as well, where we're really looking at providing resources to our service coordinators and planning teams as it relates to housing supports. I will say that some of you participate in the DS task force. They had the community resources work group, I think it was last Monday. Monday before last, that's what it was. Tuesday before last, because Monday before last was a holiday. And I presented there about our Mirasol Village project. And one thing I am hearing loud and clear is that housing navigators statewide are things that the advocacy groups and the folks from the Disability Services Task Force are interested in seeing at regional centers in California. So we certainly want to, we asked to pilot that at our regional center for a housing navigator. So it's exciting to hear that there's some statewide interest about doing housing navigators kind of all over the place. And so again, at our regional center, we have housing access services by First Step Housing Access Services that do, they're providing supports to 114 clients right now in both finding apartments and being able to keep their apartments. They actually had an opportunity to do a presentation this morning for the directors of client services at all the regional centers. And it was a pretty good brief presentation about the housing access services. And I was thinking maybe we might invite them to come over here and have a discussion with all of you so that you're familiar with this new type of service that we have at our regional center. And I will say I personally am doing a lot of guest speaking type of events, trying to encourage other regional centers to get the housing access services at their own regional center, so that they can have a vendored service that can help people find housing and be able to keep their housing. And so we'll work that into our schedule here, where we will do a presentation to our Coffee with Community Services, so more widely you can know about that type of service. And once we get our housing specialist on, we'll be happy to bring them into this meeting as well, so they can talk about their housing activities that they're doing for our regional center. With that, we also have begun, and this was also shared at our last newsletter, a Disability Housing Alliance. And this is a group of family members, clients, advocates that are interested in expanding opportunities for housing in our local area through political action, through connecting with local municipalities, talking to mayors, boards of supervisors, etc., and have opportunity. I meet with them every month, and just a lot of exciting activities that they are doing. They've engaged a lot with folks in Placer County that are looking at providing opportunities for affordable housing for our clients. We're currently working with the city of Roseville on how to fulfill their housing element. Every city plan, county plan for housing has a section in there that talks about disabilities, and we're specifically named in the housing element for the city of Roseville. And so this last week, we've had an opportunity to provide the folks from Roseville some real good demographics about who lives in the city of Roseville, where they live, what are their ages. And a lot of that demographic information is what we use to help convince people that they should take it seriously, to do things like put money aside to set up housing for people with developmental disabilities, or to partner with the regional center and share information on our websites, for example. So these are some of the activities that our Disability Housing Alliance is also assisting me with. because we have a huge catchment area and we've got a lot of family members and clients that are interested in housing. And so it's a great way to kind of keep active. And I am blown away by the work that they have done just in the last 3 months. They've developed so many documents that describe what their purpose is. They've already had like half a dozen or more meetings with different elected officials and are really gathering a great group of contacts. So as we look at doing more and more of these housing projects, we've got advocates all over our catchment area that can do things like, provide public testimony at city council meetings. So again, very encouraging that we've got, again, the group of clients and family members that are interested in the supports for housing. And that's our Disability Housing Alliance. And the next newsletter that comes out next month will also have an update from them and how to join their monthly meetings that they have as well. In addition to the monthly meetings, they do things like lunch and learns. And this is, for some of you that work in case management, the Future for Our Kids folks that are part of that group are the ones that are composing a big chunk of the people that are participating in the Disability Housing Alliance. So for example, today, actually right now, they are doing a presentation by Sunflower Hill at Irby Ranch, which is a kind of an intended community there in Pleasanton in the East Bay for people with developmental disabilities. And so they're finding out about kind of what that intentional community looks like. And and working with me so I can talk about maybe looking at possibly replicating something like that in our greater Sacramento area. So lots of interesting stuff going on with housing always. We could talk about it for hours, but we won't. Abilities Expo is coming up. I will be down there next week. Last week didn't work out too well with me reporting live from the Director of Community Services meeting. I think I only logged in at like 11:45 to say hi to people real quick. But I am going to try to. We'll see how it goes. Next Friday, it starts at 11. And so I'll try to do a kind of my little man on the street interview. Maybe we'll have Jordan run the meeting next Friday. And we'll give you updates on what's going on down at the Abilities Expo down in Los Angeles. So this will be an opportunity for myself. We have some service providers that are going down there. The Department of Developmental Services is going down there. And this is going to give us an opportunity to be able to take a look at things like some of the assistive technology that's available out there, some of the smart home technology, things that the aging world, the independent living centers, the people that really focus on aging, they're way far ahead of the regional centers when it comes to the utilization of assistive technology in people's homes. And so many of you are aware that that's something that is a component of our multifamily housing developments that we do at Alta. Each of our developers have to utilize assistive technology. And for the one that is opening up right now in Richards Boulevard down here in Sacramento, one of the units is going to have assistive technology in it as a demonstration unit so that people can come and take a look at what the assistive technology looks like there as well. So very excited about that. I'm looking forward to seeing what we're going to bring back to our regional center. This is also tied to DDS's technology pilot that they're doing, which is a 3-year pilot project worth $5 million that the state is going to be piloting. And we'll be piloting it at Alta. So we will be one of the regional centers that is piloting that assistive technology grant with some of our service providers as well, trying to figure out how we can widely utilize assistive technology throughout the state of California and figure out how to pay for it because the monitoring that goes on is a little bit different than having a person standing there, in your home. And so we'll get into more of that. Now, let's see, Rima. I wonder if we can get into our sign of the week next, please. I know everyone practiced it since it got sent out. Carol maybe didn't need to, but everyone else.
So can everyone see me? Maybe, okay, hi everyone. Are you guys ready to learn the word that I'm going to teach this week?
I'm going to spotlight
Have a nice
you
day.
real quickly. Okay.
Okay, so if you can sign with me like this.
I'm unspotlighting myself. All right, there we go.
So have, like this. a nice day. So have a nice day.
Okay, I need day.
Hopefully
Repeated.
Melissa will be involved next time in copying me and signing with me.
All right, thank you. This is going to be something that we are going to be asking Rima to do when she is available and able to join us for this meeting. And so thank you very much, Rima. You are much appreciated.
Thank you.
All right. Okay, let's go into a few more things that we need to share here. We have upcoming, let's see, we have upcoming CPP, CRDP RFPs. Okay, so request proposal, CPP, CRDP, the RFP orientation is going to be next week, March 7th, 1 to 2. We are going to offer an Avaya option. Ugh, I hate Avaya. Sorry, Avaya. Maybe I can change it. We'll do it via Avaya, I guess. But you can also come down in person, and we will be providing information about a couple of our different projects. I know Rima had an opportunity and Jordan to share about these already, but again, we've got ASL interpreting vendor with staffing registry pilot program. And then we also are doing an adult residential model. I should say probably alternative residential model, but an adult residential care home for forensic and substance use disorder. And again, looking forward to many folks turning in their proposals for that one. And again, you know, we have a very wide set of needs when it comes to our clients, and we don't have a specialized substance use disorder home. We've utilized homes down at Valley Mountain Regional Center's catchment area in the past, but it'll be nice for us to have our own local referral options for this. Okay, social recreation grants. Helen, I think we received only 3 responses back from DDS on the social recreation grants, right?
That's correct, but DDS is still working on reviewing the proposals submitted. They received a lot, but for Alta, we had 3 that were approved so far.
So maybe next week we'll go over, folks, and we can have you share, Helen, what are the 3 different social rec proposals, and hopefully we'll hear more from DDS between now and then as well, because I know a lot of our providers are wondering kind of what the status is. This was one-time funding that was available. These are American Rescue Act funds. And so it's not likely going to be a cycle that's going to occur next year. But we'll keep our ears out and eyes out. For us, we had some folks that we don't do business with currently that have expressed an interest in this. And so it's nice getting new people interested in working with our clients and providing opportunities through this grant process. So we'll share with folks a little bit more about that. ICFs. So we are having a vendor forum on March 7th at 10 a.m. for our ICF providers. Again, I don't know that we've ever held a ICF specific vendor forum in the past. I really hope that every ICF provider attends this meeting. This will be an opportunity for people to discuss the impending change to managed care Medi-Cal for the individuals that are in the ICFs and what the impacts are. So the main topic is we're going to discuss that changeover, which we now know has been postponed to January of 2024. I believe it was going to be at the end of June, and now it's been pushed to January of 2024. But we're already hearing impacts from our ICF providers. I know Johnny Zhang, I'm sure the residential managers are starting to hear a lot about these issues and the impacts. And so for us, we just really want to determine what are all the things that we can do to provide support to our providers. So we really want to hear in a group setting, what are the impacts that people are seeing already? What do people have concerns about? Certainly, we've heard the complaints related to the loss of utilization of in-network doctors. So our doctors that are currently working with the ICFs that may or may not be within the network of the clients once the switch over occurs. We've also heard of folks that have been denied things because of confusions related to whether or not the ICF is the same as a skilled nursing facility. And intermediate care facilities are not the same as skilled nursing facilities. Skilled nursing facilities have already done the crossover to managed care Medi-Cal. That was back in January. And so some of our providers have indicated that they feel like they're lumped in with that. So hopefully not the case. And anything that we can do, we want to provide that forum and an opportunity to hear from our providers. That gives us many months, hopefully, to do advocacy and get clarification from statewide partners on how we can best do this. I know Valley Mountain Regional Center has already met with their ICF providers related to this. And I think their clinical director's kind of been involved in some of these discussions as well. So stay tuned for that if you're an ICF provider, certainly on the residential end. I think we sent it to facility liaison supervisors as well so that they could attend. And if you've got your ICF liaisons, usually there's not a ton at our regional center that are doing them with ICFs, but they certainly could come to that meeting as well to hear kind of I'm sure they're already hearing it from the providers, but they can hear about it in one spot at that meeting. I want to just provide an update real quickly about Sierra College and the activities that are going on over there. Had an opportunity to go with Carly, our employment specialist, over to Sierra College on some freezing cold, rainy, windy day this week. And while we were there, we talked a lot about the new projects that we're doing over there. So we have our employment grant that was a project that is in partnership with Sierra College and really looking at creating a statewide blueprint for working with individuals with developmental disabilities and that coordination with best practices in employment and in communication between I guess I learned that you're not supposed to call them junior colleges or community colleges. They're just called colleges now. So the colleges and the regional centers, and there's the hope to develop kind of some statewide blueprint activities related to the employment grant. And then also we've been having a lot of activities about the Taft College program. So the transition to independent living program that occurs at Taft College. The president of Taft College is now the president of Sierra College. And he's got his staff that work down at Taft and they're on as consultants. And we are looking at getting that project on board for our clients as early as spring of 2024. So that would be the January of 2024. We tried to push it for August, and we just can't get everyone hired and on board at Sierra College in time for us to launch the project. We've made tons of progress, and it just illustrates that when service providers get us those program designs really fast and we can have those rate negotiations pretty quickly and easily, which we were able to do in this case, we can move vendorizations along very quickly. So we are working on a residential component of this as well. There are some dorms that are being renovated over at the Sierra College campus, which will be opening us up to opportunities for a residential component at the Transition to Independent Living program as well over there at Taft College, at Sierra College in Rockland. So very exciting stuff for us. Our previous executive director, Phil Bonet, had really wanted for years and years and years to bring this type of project to our local area. And we just didn't have what was needed at Sierra College and didn't really have what was needed here at Alta to be able to put all the things in place, and things are coming together nicely. For those of you that are vendors, we already completed the rate negotiations and we're pretty good with the program design. So, that's 95% of it when it comes to the vendorization stuff. So it's going to be Sierra College hiring staff and us operationalizing it, but very exciting opportunity. I will tell you, every parent that I talk about, everyone that hears what we are looking at doing and bringing that project to the local area, people are very excited about. So as that comes more to fruition, we can have Carly come and talk more in depth about what that service is looking like. She's working a lot with them right now. That would be putting an independent living vendorization and, oh gosh, what does CASS stand for? Community Activity Support Services, I think. It's service code 063 vendorization. Community Activity Support Services, also on the campus there as well. So very excited about the Sierra College stuff. One last thing. I have received from my dear friends in Sacramento County a message indicating that they have hundreds of thousands of over-the-counter COVID tests that are available for our community. And I don't really have the bandwidth or ability to run big giveaways like we have done previously at our regional center while we're concurrently operationalizing many new things from the Department of Developmental Services. If you are a service provider and you are interested in stepping up possibly and maybe helping out with distribution of test kits, again, these are over the counter. I think they're individualized. They're not the boxes of 20 like we had previously of the COVID test kits. And these would be coming from Sacramento County. So if you're a provider and you are interested in that, and if you wanted to reach out to Zach, Zach will put his email there in the email box and the chat box and let us know. I want to get back to Sac County probably by Tuesday, Wednesday of next week. So I know in the past, we had some of our larger providers, so On My Own and STEP definitely, and we had lots of different folks that worked on. Yeah, thank you, Zach, for putting that in there. UCP did multiple times, did pickups. We've had, for PPE, it's been different, but for the test kits, we still know people are testing positive for COVID constantly. So this may be something that, folks are really interested in. If I can't really find anyone that's interested, I'll kind of see what State Council on Developmental Disabilities might be interested in doing as far as distribution, but just get in touch with Zach if that's something that you're interested in and helping out with. And for those of you that are up in the mountains, now that I've, let's see, are you sure you want to stop